Another septal defect is the ventricular septal defect, which is when there's a hole in the wall between the left and right ventricles. This means that oxygen-rich blood from the left side is pumped to the lungs instead of to the body, and this can make the heart work faster. Some of the symptoms of this defect are poor eating or failure to thrive, fast breathing, easy tiring, or heart murmurs. And these can all be seen in an ultrasound before birth most of the time. This defect is often occurring early in heart development and is caused by a mix of genetics and environmental factors. Some of the complications include pulmonary hypertension, which is high blood pressure in the lungs, Eisenmenger syndrome, endocarditis, which is a heart infection and is usually uncommon, and other heart problems, which include abnormal heart rhythms and valve problems. For diagnosis, a doctor may use chest x-ray, an electrocardiogram, an echocardiogram, which can also be used on a fetus, cardiac catheterization or pulse oximetry, which is a small clip on the fingertip which measures the amount of oxygen in the blood. Some medications used to treat this defect are digoxins, which increase the strength of the heart contractions, diuretics, which reduce the amount or the volume of blood that needs to be pumped, and beta blockers, which keep the heartbeat regular. Some of the procedures to treat this defect are surgical repair, usually preferred, and involves open heart surgery under general anesthesia. You'd have to be put on a heart and lung machine, and it is through an incision in the chest. Usually, the surgeon will use a patch or stitches to close the hole in the septum. Another option is the catheter procedure, which is when a specially sized mesh device is inserted in the hole through a catheter in the groin. Or another option is a hybrid procedure, which accesses the heart through a small incision and is performed without stopping the heart and using a heart-lung machine. The device enters through a catheter through the incision, and usually it has the patient will have a quicker recovery than if they go through an open heart surgery.